Hello and welcome to the Diabetes Rewind instructional video. I'm Tony Willis. I'm the Clinical Director for Diabetes for North West London. Rewind is a new and exciting program to support patients achieve significant weight loss, potentially come off diabetes medication and potentially achieve remission. We've had some really fantastic results in the pilot so far, with significant weight loss, about 13 kilos on average, and some patients achieving in excess of 30 kilos weight loss, with some patients coming off significant numbers of diabetes medications and achieving remission. So really exciting program to be part of, and we're hoping that your patients will find this too. So, first stage in the program is to identify patients. We've created some reports on SystmOne, and we'll be doing similar reports for EMIS. So you want to look into the Hounslow PCT Trust folder on SystmOne, and then scroll down to find the North West London Enhanced Services Monthly 1920 reports, NWLES Monthly 2019-20. And in there is a folder number 19 called Diabetes Rewind. You'll run the search for patients suitable for Rewind program, that's REW00-ES-register. So you want to run that search to identify the patients, and then, as usual with other invitations into programs, you'll want to do a bulk action with this group of patients, or potentially view your list of patients. Obviously I'm not going to show you patients from my practice, but you've got your usual list of capabilities here, including send bulk SMS messages. In many cases you can do this through the integrated SMS program that many of you are using. So here's an example of the kind of text message that we're recommending. Would you like to lose weight, reduce your diabetes medications, and or put your diabetes into remission? Rewind is an exciting new program which can help you achieve your goals. Click for details, and the Rebrandly URL takes the patient to the specific page with information on there. To be referred, please respond yes. Please note that your GP will confirm that you're suitable for this program before you're enrolled. So there's a sort of key clinical eligibility step to perform there. By replying yes, you're giving us consent to share your record with ICS, diabetes related information only. So ICS are the provider of the program. They're also the North West London provider of the National Diabetes Prevention Program. So that's basically the initial search part of the program. We'll then follow on with referral into the program with another section of the video. So we're now going to look at the referral process for Rewind. We've got a test patient's record up. Normally on a clinical record of somebody who's eligible for the program, there'll be a status alert on the home page. So you can either go into the, and this is what I would recommend, you can either go in through the auto consultation, selecting the Diabetes Rewind Enhanced Service clinical template. You could click on the status alert, or alternatively search Rewind down the bottom left and select the top template that appears there. So we'll go through the auto consultation under Diabetes and Endocrinology, the Diabetes Rewind Enhanced Service template, and you'll see on the clinical template the criteria for the patient. Just a little reminder about what the program involves. You can click on the protocol, you can print off a patient leaflet by clicking on the information leaflet. You can view the full criteria for inclusion in the program. But ultimately the key criteria, they're registered with a GP practice in North West London, they're aged 18 years or over, they've got their diabetes for less than 12 years, and key to this is that they're on a DPP4, an SGLT2 or a GLP1 medication. And ultimately the patient understands and can meet the demands of the program. Important to understand that there is a roughly £2.20 cost per day for the total diet replacement product for the patient. We're confident that this is affordable for patients, as this will be roughly the cost of food, and we've had a number of patients who are on benefits who've already signed up for the program. So in order to refer, you'll click on the referral button, and that will launch a protocol depending on which CCG you're in. It'll highlight which pathway that patient is eligible for, whether it's the total diet replacement, which is the pathway that we would recommend by default, or the low carb pathway. In this case, the patient is eligible for the low carb pathway rather than the total diet replacement. So click on OK. So then we click on the CCG button, and it opens up this referral. Again, inclusion and exclusion criteria, much more specific and comprehensive. You'll be able to view the BMI of the patient. Just watch out for patients that are lower than the 27 BMI who are not from BME groups such as South Asian and Chinese. So referring to the program, click this button and it will launch the word template. You click right now and you'll get the word template coming up. Nothing else needing to do at this point to select specific referrer. So again, a reminder of the inclusion and exclusion criteria. In this patient, the patient was eligible for the low carb pathway, but not the low calories. So just put in yes and no into those, and the reason for that. Ensure that you've put in the NHS number will auto-populate. Obviously this is a test patient, so not appearing there. Can we leave a voicemail? So yes is the answer there. Can we leave a voicemail on their mobile? Yes. Is the patient on severe mental illness register? No. Is the patient on the learning disability register? No. It'll auto-populate some of the key clinical parameters such as BMI, etc. This test patient doesn't have an EGFR, but in most patients that will be present. The referrer details, and important just to confirm with the patient a number of things, that they understand that their data will be shared to be able to evaluate the program. Also, as a clinician, that you are responsible for completing the patient's HbA1c measurements, blood pressure and body mass index at 3, 6 and 12 months, and for reviewing their medication management. Obviously a key part of this program is that patients stop their medication when they enter the program. So just ensure that that's the case. It'll auto-populate the medication that the patient is on, in this case canagliflozin and metformin, which ensures that they're eligible for the program. Then you want to save the final version into the clinical record. So that will get saved into SystmOne. So you can close that clinical template, close those down, and you go to the referral node on the tree, and down at the bottom here we'll see referral to healthy lifestyle program. Right click it and send via NHS mail, existing contact, and you'll be looking for rewind program, ICS health and wellbeing. So select that, and you might want to put in a little message to them such as this is a rewind referral. I'll in this case just say this is a test referral for the demo video, not an actual patient, and that will get sent after the record is saved. So now I'll save out of the patient record and the referral is completed. Okay, so we're now on to the point where the patient has been referred into the Rewind program, has been accepted for their has had their initial assessment, has been accepted, and we're going to go into the record on the clinical template and do the coding of program start. So in this case, down at the bottom where it says start, code both programs, start dates, program started tick box, put in tomorrow's date, in this case because the patient is attending tomorrow, and will be on the very low energy pathway, which is total diet replacement, as you can see here. The other option is the low carb, but in this case the patient is on the total diet replacement pathway. And the other really important thing is stopping their repeat medication of whichever medications are appropriate according to the protocol. So in this case the patient is on metformin, which we're going to keep going, but is going to come off their canagliflozin. So within this view here you can just right click and you can go stop, and we'll put in clinical grounds, joining, if I can spell that correctly, rewind program. Just like that. Okay, so that medication is now stopped. We've coded the patient as having started, and we need to ensure that we've communicated that information to the pharmacist, and also that we've spoken with the patient to communicate that clearly to them. So I'm now going to go out of the patient record to save that, and there we go. I'm now going to take you through the monitoring of rewind. So again, using the same rewind template, you can see the second tab is monitoring and end of program. So within the first 8 weeks, the key information to record is blood pressure. All of this can be done over the phone, and also the previous step of communication with the patient about stopping medication can be all done over the phone, so the patient doesn't need to come in. So we've just had I've just had a quick word with this patient, and they've got a home blood pressure machine that they've told me their blood pressure is 130/78, so I'll just put that in, and their blood glucose levels have been fine. So blood glucose good, and they have been between 5 and 7 when they've been home testing. So you just click the OK on that, and that records that information for weeks 1 to 8. At 3 to 6 months, so 3 and 6 months, we need to record blood pressure, HbA1c, which will be automatically brought in from the lab. Generally the height won't change, but the weight hopefully will have changed. So in this case, the patient has come back at 3 months, and we check the blood pressure. It's 130/67, so it's dropped a bit. Their latest HbA1c, let's say, is 48. Their weight has dropped significantly to what's the average? So 75 kilos, and that's all that needs to be done at 3 and 6 months. At 12 months, the additional requirement is to check the cholesterol, and also to code the fact that the patient has completed the program. Obviously, if the patient drops out early, then you might put in a healthy lifestyle program not completed, and the date that that happened. So in this case, the patient did complete, so we're just going to code that. So hopefully that's the information that you need to support you in managing, referring and managing patients on the Rewind program. Just to say at this stage, it's a really exciting program. I've got a patient who's now lost 35 kilos, he's come off 3 different diabetes medicines and some of their antihypertensive medication, feels the best that he's done in a long time. So significant improvement in mental well-being as well as the physical components, and that's normal for a total diet replacement program of this sort to be achieving. So there we go. Thank you for watching, and I hope you enjoy seeing the results of this amazing program in your patients.